My name is Mary Madden, and I'm the Assistant Director of Programs and Grants at C2ST. Welcome to today's program. This program is presented to you by the Chicago Council on Science and Technology in partnership with NAMI Chicago. NAMI Chicago is a local resource for mental health support, education, and advocacy. Their helpline is available 7 days a week for free mental health support and help finding the right community resources. You can call them at 833-626-4244. They also offer mental health education and training courses via webinar. Visit their website at namichicago.org to learn more. For those of you that are new to the Chicago Council on Science and Technology, C2ST is a 13-year-old not-for-profit organization that seeks to enhance the public's understanding and appreciation of science and technology and their impact on society. C2ST hosts around 30 free or low-cost in-person and virtual programs throughout the year on any and all science and technology topics. Please visit c2st.org to learn how you can donate and get information about C2ST's upcoming virtual programs. Remember to sign up for our mailing list so that you can get reminders about these programs as well. A couple of housekeeping items before we get started today. Please type c2st.cnf.io into your web browser and click on today's session to ask questions throughout the talk and evaluate the program at the end. You'll also be able to ask questions in the comment section on YouTube and Facebook, where C2ST staff will copy them over into the app. Again, though, if you want to ask questions straight into the app, that's c2st.cnf.io. Now I'd like to introduce our speaker for today, Dr. Orson Morrison. Morrison is the director of the DePaul Family and Community Services and is an affiliate clinical associate professor at DePaul University. He provides staff training, clinical supervision, and is involved in program development and oversight of clinical services at FCS. Morrison has spent his career working with children, adolescents, and families that are involved in the child welfare system and those impacted by poverty. Dr. Morrison's professional interests and areas of expertise include clinical management, psychotherapy with underserved children, adolescents and families, psychological assessment, multiculturalism, and working within a social justice empowerment framework. Without further ado, let's welcome Dr. Orson Morrison.
Thank you so much for that introduction, Mary. I'm so pleased to be here today talking about the pandemic and sort of strategies for children and families during this really unprecedented time in our history. A little bit more about the center that I direct at DePaul University called Family and Community Services. We are a full-service behavioral health clinic located on the Lincoln Park campus of DePaul University, providing therapy services, psychological testing, early childhood services such as parent-child interaction therapy, as well as a number of school-based partnerships with local CPS schools, Chicago Public Schools, as well as in the Oak Park School District. So without further ado, what I'm going to be talking to you today about are the factors that may impact our emotional reactions during this really unprecedented time in our history. I'm going to review some of the strategies that we might consider using in order to help manage stress and anxiety in our children and in our families. I'm going to end with a very brief guided mindfulness practice. I really love mindfulness-based approaches, and I feel like mindfulness has really been helpful for me personally during this time. So without further ado, some of the factors that impact our pandemic stress and anxiety. And since this is such a unique time in our history, there isn't a lot of research out there about how pandemics impact us emotionally. And so we've had to look at some of the research on other unique events such as world wars, other sorts of health-related crises in the world, other sort of traumatic situations where families maybe have been displaced from their homes, refugee status, etc., and look at some of the research on those topics to get a sense of how we might be impacted during the current pandemic. First topic I want to talk a little bit about are racial, ethnic, and cultural disparities. We know that the data has demonstrated that COVID-19 has been disproportionately impact African-American populations, Hispanic populations, indigenous populations. And so, we need to be thinking about how various populations may be experiencing stress and anxiety differentially. We're also in a time in our history where we're talking a lot more about racial injustice, and there's been quite a few high-profile cases that we've all been talking about and learning about. Sort of that overlay can really also impact stress and anxiety. Trauma, mental health history is also important to consider. So if you or anyone in your family had a previous history of a mental health diagnosis like anxiety or depression, or had previously experienced trauma, you may be struggling more so. Your vulnerabilities around mental health make this current pandemic situation feel quite intense. Health-related stress. So if you have a pre-existing health condition like asthma or diabetes, if you have any of the symptoms associated with COVID-19, all of that can also impact our anxiety, our worry. Do we have COVID? Will we transmit COVID to other people? Disability status. We know that folks with physical disabilities, with emotional disabilities, are particularly vulnerable during these sorts of stressful life events. People with disabilities often need access to certain services, whether they be health services or other resources, and the current pandemic situation may make it more difficult to actually access those services in an efficient, safe way. There's been a lot of talk about income and financial stress. People have lost jobs, companies have laid off parts of their workforce, particularly if they are the type of organization that's been impacted by the COVID-19 situation. Access to goods and services. So, many of us have experienced situations where we've gone into a grocery store and we have not been able to find some of the basic things that we need. That creates enormous stress and anxiety. School and work modification. So as a parent myself, I know how difficult it is to sort of be working and also attending to children who are doing remote learning, for instance. Also for the kids, adjusting to being on a screen for their educational day has been challenging for some kids. And of course, the public health response around physical distancing. We are social beings. Many of us have not been able to see our loved ones, our family members, our friends, our neighbors, as much as we used to. And so that's creating an enormous amount of stress. Some of the research around quarantine that does exist has suggested that the longer a period of quarantine goes on, the more impact, of course, that's going to have on our emotional health and well-being. And the longer it goes on, the longer it's going to take for us to recover emotionally once this is all over. So even when we have a vaccine and we're able to sort of go back to some of those in-person activities, we may still be struggling with a lot of worry. What's safe? Where can I go? How can I do this safely? Age and developmental factors. So certainly kids at a very young age, they're going to require a lot more attention from adults. And so that may make it really difficult for a parent who's working from home. Certainly a lot of the teenagers that I see in my practice are really struggling. I mean, they're at a phase in development where they're wanting to be with friends, they're wanting to date and explore their identities outside of their families. And so that's been really challenging for some teenagers. Information is really important too as it relates to our stress and anxiety. If we're getting mixed messages from public health officials or from the government, that may increase our anxiety. If we're not getting timely information, that can also create a sense of stress. I want to talk a little bit about adult-child relationships. So many of us are at home with our children, and so there's a lot of adult-child contact at the moment. And so these are just some really helpful tips, I think, to think about. First of all, with regards to stress and anxiety, our kids are watching us. And so we really need to be mindful of how we're reacting, how we're responding in terms of our own emotional stress as adults. If we are catastrophizing, using catastrophizing or threat-based language, that's going to really raise the anxiety level of some of the kids that in our kids and our children. Over control. So certainly we're in a period right now where we're concerned about our safety, and so as parents and adults, we're sort of clamping down on the access our kids have to the environment. But we need to also create room for them to still have choice in terms of their daily routine, their activities, to help them feel a little bit in control of their lives. And of course, rejection and lack of warmth. So if we're not being validating, being supportive as adults, that can certainly impact our kids' emotional health. So some additional strategies to consider. Right now we're not going out as much. We're not having so much distraction going on in our lives. We're usually at home or in a very small sphere of interaction. And that's really creating some space, I think, for many of us to reflect and to go inward. Asking questions, what's my life about? What's important to me? Who's important to me? This can be a really, really important time to really reflect on, where your family is. Maybe you can use this time during quarantine to reflect on, what are the things that we do as a family? What can we change that might actually result in our family being stronger and healthier over time? So things like, carving out more family meals, or journaling, reflecting together as a family, checking in with each other on a weekly basis. Communication and empathy is a really important strategy as well. So how we're communicating, how we're seeing and recognizing the signs and symptoms of stress and anxiety and grief. This is quite a situation of loss. We've lost the ability to interact with people, to engage in certain activities that we once loved. I think of kids who are into sports, for instance, that has really been impacted, or theater. Teaching children about pandemics and about prevention practices can also be really helpful. So talking to kids in developmentally appropriate ways about how they can care for themselves in a safe manner. Taking a listening approach, so not lecturing to our kids, validating them, recognizing that this is a challenging time. Yes, this is a very hard time. And I think be vulnerable, which goes along with that modeling approach. So we all as adults are also struggling, and so we're going to have some bad days, but being open to talking about that and modeling for our kids. This is a really difficult time for me as well, and this is how I'm trying to cope. Child and adolescent development, there's so much identity development that's happening here at this age, and many of the activities that they once did, like sports or theater, have been impacted significantly by the social distancing recommendations. And it is an opportunity, perhaps, though, to try different things. So encouraging our kids to try different things as a way to perhaps further their identity development. So perhaps your child has never been into cooking, but now they're at home so much, and maybe this is an opportunity for them to try that out, even if it's just mac and cheese. They may actually find a new hobby or a new part of their identity that they want to explore. Certainly, there are other things like gardening or other hobbies that you might want to try with your child as a way to help them promote healthy independence and identity exploration during this time. I want to talk a little bit about social media and tech use. I get a lot of questions about this from family members. Because kids are not able to do the things that they usually do, many kids are turning to video games and other sort of tech as a way to either connect with friends socially or to manage their boredom. And I think it's really important to stop and ask, how is that particular activity serving us, either as adults or as a child? My thought is that if kids are able to use it as a way to stay socially connected, that is definitely a positive sign and something to be fostered. Of course, we don't want it to take the place of other really important things like exercise, being outside in nature, giving our minds and our brains some downtime. Those are all really important developmental needs that children and adults have for that matter. So we want to just sort of balance the benefits of the social media and media use with some of the concerns. Anxiety and stress is just such a physical, condition. It's held in our bodies. Our muscles get tense, and and so the more possible you can engage in healthy, regular physical activities, whether that be going for walks or bike rides, making sure that we're eating healthy and getting enough sleep. Those are all crucial during this time. Routines and rituals. This is a really big one and an important concept to really think about because our lives feel so uncertain at the moment. We don't know how long this is going to go on. We need to spend some time shifting our energy and our attention and our focus to the things that are actually predictable. And that may mean building in some new routines, some new schedules, as much as possible. That regular rhythm of our day and our lives helps to counteract some of the uncertainty that we're feeling. Family meals, maybe having a set time in the evening where you go for a walk as a family or a bike ride, family meetings or check-ins. I think also just attuning to the natural rhythms of life, things that are constants in our lives. So the changing seasons. Right now it's sort of middle of the summer and you can kind of go outside and see some of the monarch butterflies that have hatched from their cocoons. And there's something reassuring about that there's some natural stuff that's continuing in a predictable way. Social connection, we've talked about that and how important that is. A lot of people are connecting virtually with family and friends. I think a lot of kids are struggling with boredom, so there's maybe limited access to activities, and so sitting down as a family and maybe making a list of go-to activities, whether it be board games or puzzles or art supplies or books to read or things that they can do outside in the community that's safe, as a go-to list. So if you're feeling bored, here you can go to this list of potential activities. And if your family was connected pre-COVID to any sort of community activities, the best you can, try to stay connected, even if it is virtually. That normal, regular connection is very, very important. I want to talk a little bit about some concepts from interventions that we use that might be helpful also to think about. One is called dialectical behavior therapy, this concept between acceptance and change. And so we want to be able to sort of find the sweet spot. There are things about this COVID situation that we have no control over. And the more we resist that, the more we deny that, the greater our stress and anxiety is going to be. So we need to focus and let go of the things that we can't change about the situation. But we can put our energy into other things that help us problem solve the situation. So whether that be creating new routines as a family, whether that be checking in with each other, those are all things that we have control over doing. Another concept called cognitive restructuring from cognitive behavioral therapy is really being mindful of our catastrophic thinking, or the black and white thinking that sometimes we get into when we're really anxious and stressed. So if we're really, this is, we're all going to get COVID. No, we're not. And there are ways in which we can protect ourselves. So really putting that negative thought on trial, so to speak. So let's look at the evidence. Let's go to the public health websites and look at the science behind wearing masks and protecting ourselves another way. And that help us to feel a little less stressed. And then finally, I want to talk a little bit about altruism and a related concept called Ubuntu, which is an African term that really speaks to the benefits of being more mindful of our community. And I think when we talk about wearing masks and social distancing, it's not just about us. It's also about how we're protecting our community, how we're keeping our communities safe and other people safe, and reminding and teaching our kids about that. I think particularly some of, it's been really helpful for me in talking with some of the adolescents that I work with who are very much sometimes very focused on their own needs and wants, to be able to sort of expand that thinking to what is the community impact of our behaviors. I want to talk a little bit about mindfulness, and then I'm going to play a guided meditation here. For those of you that don't know what mindfulness is, it really is a way of being, a very intentional way of being that allows us to pay attention in this moment to whatever's going on. So it could be in our thoughts, in our emotions, in our behaviors, and to attend to those things without judgment. Part of what happens with stress and anxiety is our minds go to the future or to the past, and we start to ruminate on what could be. We anticipate the worst happening, or we're thinking about things that have happened in the past. And so being more mindful, being more present in the moment can actually help us manage our stress and anxiety, particularly in moments like what we're living through now. I have developed this activity called Ubuntu breathing activity. It's a few minutes, and we're going to play that now.
Taking a moment to get into a comfortable posture, one that helps you to feel alert and awake. Closing the eyes if you feel comfortable, and bringing your attention inward, focused on the body sitting, checking in with and noticing what is present regarding thoughts, emotions, and body sensations. This is an opportunity for you to become aware of what is going on for you in the present moment, in the here and now. And once you are aware of what is going on now in thinking, emotions, and body sensations, gradually shifting your attention to the physical sensations of breathing, using your heart as an anchoring point. You may find it useful to place your hand on your heart while attending to your breath. Notice the expansion of the chest and the abdomen as you inhale, and the deflation as you exhale. Just be with your body breathing for a moment. Finally, shift your attention outward to the entire body around your breath, to any and all sensations, the temperature of your skin, the feeling of clothing on your body. The best you can, bring a sense of openness and receptive attention to your experience in this moment. Allow your attention to expand further into the room, noticing any sensations, sounds, smells, for example. Continue to allow your attention to expand further outside, to your neighborhood, to your town, region, and country. Allow your attention to reflect upon our global connectedness to one another in this moment. And when you're ready, gently bring your attention back to the room. Open your eyes, but hold on to that sense of openness and connectedness.
All right, well, welcome back. I hope that was a little bit relaxing for all of you. And finally, just to wrap up, we've been at this now for 5 months or so. We've been dealing with the current pandemic situation for a while, and I often get the question from parents, how do I know if my child needs to see somebody professionally? And I think, it's to be expected for all of us to be experiencing the signs and symptoms of stress and anxiety during this time. However, if you're noticing any prolonged changes in functioning, particularly with regards to school functioning, relationship functioning, intense emotions, not sleeping, not eating, and that's been going on for quite a while now, maybe since the beginning of the pandemic, it probably is time to at least talk with your physician, your family doctor, about the signs and symptoms that you are experiencing or seeing in your family member. With regards to child therapy, it's always important to involve them in the decision, sit down and talk with them about what therapy is. Right now, a lot of providers are making services available via telehealth, so that can be another safe way to access therapy services during this time. So with that, I am going to end the presentation. There are some references that I can share with whoever would like them, and I'm open to some questions.
Thank you, Orson, for that great presentation. We do have a number of questions coming in through our Conferences IO app. Just as a reminder, you can come ask questions at c2st.cnf.io. All right, we'll get started. So our first question, Orson, is what are some things that teachers can do to help students manage their anxiety when online school resumes?
This is a really great question, timely question. I think that having touch points with students as much as possible, maybe having office hours where they can sort of check in one-on-one with students just to see how things are going. I think those are some strategies to really help. Also, creating community with students online, some icebreakers, some regular check-ins during the class time can also be helpful.
Awesome. Our next question is related, but can you provide tips for taking a listening approach over lecturing?
I often like the concept of mirroring. So it's an active form of listening without taking control of the situation or the conversation. So if a child says something to you, just say it back to them in their own words so that they know that you have heard them, that you understand them. Certainly you might have an opinion about what they say, but always start with what they have told you.
All right, so our next question online here is, with the goal of reducing stress and anxiety, would you recommend a more structured schedule for children during quarantine or one that gives them more free time and free choice?
It's definitely a balanced approach, I would say. I think, as I mentioned, building in some regular routines and regular structure can actually help to counteract this feeling of uncertainty that we're feeling and that kids are feeling during this time. But we also want to make sure that they have some room in their schedules to make some of their own choices within a set boundary, right? Because we want to obviously make sure that the activities that they're selecting are safe and such. So definitely a balance.
Great. Can you speak more about coping with catastrophic thinking, especially if we don't exactly know where to go for valid resources?
Yeah, it's hard to know. With such a unprecedented situation, it is hard to sometimes wrap our minds around what's happening. But there are some really good information on some of our public health websites, the CDC websites, for instance. Going to those sites, which have been organized in very, very useful ways, I think, around the pandemic and coping. Even SAMHSA, the Mental Health Administration, has a lot of really good resources on coping with the emotional impacts of being in a pandemic.
Thanks. I know that'll be helpful for me. We have another one from a parent who says, I find it difficult to find time for myself now that my kids are home and I'm working remotely. Can you recommend some mindful activities?
Yeah, I mean, mindfulness is so nice in the sense that you can really apply it to anything. You can cook dinner mindfully, and that may be a moment where you're really immersing yourself in, particularly if you enjoy cooking, the aromas, the visual aspects of cooking. You can almost lose yourself in that experience, even for a brief moment. Or going outside and just standing on your front porch and really taking a few deep breaths, looking at the surroundings. Maybe there's a tree outside or some flowers that are growing. Just immersing yourself in those little things and using all of our senses can take us away momentarily from the anxiety and the stress that might be kind of consuming us.
And we have time for one more question. So they asked, how much information is too much? How informed should we be keeping our kids when we don't even really know what's going on?
Yeah, that's a great question. And I think we need to also approach it in a developmentally appropriate way too. So for the younger kids, we're going to talk in very simple language. We're not going to give them too much details. We're going to talk about sort of a germ in the environment that's causing a lot of people to be sick, and this is why we're wearing masks, and language like that. But of course, older children and teenagers, they actually often want more information. I think often taking our children's lead, maybe they have particular questions that they're struggling with. So I would always start there. What questions do your children have? And then trying to figure out a strategy for answering those questions together, going to websites together, talking to a professional together if you need to, but really answering their questions.
All right, well, thank you so much for all those thoughtful answers, Orson. And I want to thank everybody for tuning into today's program as well. Just a reminder to please go to c2st.cnf.io to evaluate today's program for a chance to win a gift card. It really helps us out to continue to be able to do virtual programming like this. Thank you again, Orson, for a wonderful and informative presentation. I also want to take this time to thank today's partner, NAMI Chicago, for supporting C2ST. If you enjoyed today's program, please consider donating to C2ST at c2st.org, where you can also find archives of our previous programs. You'll be able to watch this one if you'd like to again. We also have some timely STEM blogs on there. So thank you again, everybody, for watching.
Thank you, everybody. Be well.